It is another episode of the Cirque de la Vie, proudly sponsored by CN Tickets and Events. So today, we want to go into the health sector, want to delve into the health talk today, and I have Mr. Obajobi Matthew. So please, can you kindly introduce yourself properly?
Okay, my name is Dr. Obajobi Timi Matthew, a resident of obstetrics and gynecology in University of Nigeria Teaching Hospital.
Welcome, sir. Thank you very much. So today we want to be discussing about menstruation and ovulation. A lot of young ladies don't know how to calculate their ovulation. I know, I get that a lot. And there are menstrual irregularities going on that we need to know. So our doctor is here to answer all the questions, or probably let me say most of the questions we are asking, or we will ask him. So please, can you briefly tell us about menstruation before we ask those questions? Just briefly, tell us about ovulation and menstruation.
Okay, ovulation is one of the phases in menstrual cycle.
Okay.
Menstrual cycle is a monthly shedding of endometrial lining in every reproductive woman from the age of 13 years to 45 years. When they are 45, they are already reaching the menopause. So every month they shed out the endometrium because there is no fertilization that take place. So some call it a weeping womb because no fertilization take place.
Oh.
So how does it start from the age of puberty? It starts from the brain. We call it hypothalamus, whereby some hormones are secreted from the hypothalamus. We call it gonadotropin, releasing hormones. Then it will now activate a pituitary gland. Now the pituitary gland will now release a follicle stimulating hormone that will go and tell the ovary that now I'm ready. So it will bring up about 13 to 15 follicles. So this follicular stimulating hormone will be nurturing this hormone, then call other hormones together to come and help in the process, like luteinizing hormones. So from the first day the woman start having the menses, this follicular stimulating hormone have already started working, recruiting 15 follicles. So it will be nurturing them, bringing them up, releasing other hormones. Then from the that we call that one follicular phase. Then that from the first to fifth day of every menstrual cycle. Then from that 50th day above, it will be nurturing those follicles. From the 14th day, those follicles, they are ready. The estrogen has already reached the apex. Now those follicles, because the other follicles there are already dead, remaining one, the one that is where we call it a dominant follicle. So that dominant follicle, with the help of estrogen, will now release the oocytes.
Yeah, sorry to cut you short.
Okay.
You know, most of us, we're not in the medical line,
Okay.
and you're using some medical terminologies that we may not really understand. Okay, so let me cut you short there.
Sorry for that.
Sorry. Whenever you explain, let me start with the questions. I think it will help us. And please, whenever you explain, just break down the anatomical or the medical terminologies that you use for better understanding.
Right.
So I'm going to start with question number 1, which says, please, can you share a simple and effective way of calculating my menstrual cycle, because I don't have the regular 28 days cycle?
Okay. For me to answer that, I would like to know what I would first of all, I will tell you the normal cycle. Yes.
Yeah.
So the normal cycle every month is there are some parameters we use. The frequency of the cycle every month, the duration of the bleeding, the volume of the bleeding. Now, the International Federation of Obstetrics and Gynecology, from if your cycle is within 24 days to 38 days, you are okay. If your bleeding is less than 8 days, that is between 2 to 7 days, you are okay. If the volume of your menses is between 5 to 80 ml, you are okay. So now, for you to know if the cycle is normal, or now we now also the variations. If the variations is within 7 to 9 days every month, you are okay. So you cannot use these parameters to measure if it's having correct cycle.
So the question here is the effective way of calculating the menstrual cycle, because some people don't have the regular 28-day cycle. Some people have 24, some people have 25 days. You understand? So the question here is the simple and effective way of calculating it. At times, menstruation do alter.
Of course.
You understand? So
of course.
How can one calculate it? Let me use 25 days as an example now. Like, I have 25 days cycle. How do I calculate?
Okay, very good. From the first day you see the blood coming out, you start counting from that day. From day 1 to 14. From that day 14, that 14 is that is ovulation. So the ovulation occur at that day 14. From day 1 to that 14, we call it follicular phase, whereby the follicles are being nurtured till day 14. By day 14, the egg is already released, ready for sperm to fertilize it. Do you understand me?
Yes, sir.
So from that day 14 to from day 15 to 28 or to any day, we call it luteal phase, whereby the egg is ready, waiting for a sperm.
For fertilization.
Yes.
So it's also not safe, right? The 15th day you mentioned.
The 15th day, no, yes, from 8th day to 18th day, they are not really safe. Though the ovulation takes place on the 14th day. Because we believe that anything you do from 8th day, you start see your menses. The sperm has lifespan of about 72 hours. So if that sperm, if you have sex on the 8th day and your ovulation now occur on the 14th day, do you understand me? So it can still fertilize the egg.
Fertilize the egg.
Yes.
Okay, that leads us to the next question. You've actually used one stone to kill 2 birds. That's what you did.
It's all right.
Okay, so let's say people do have heavy menstruation and light menstruation.
Yes.
Is there any factor? What's causing? Why is it so? Why don't we have the same menstrual cycle? I mean, the bleeding, the blood flow that comes out. Why should one have? Because people do have extreme bleeding. You understand? And to them, it's normal. You understand? So
Okay.
what's the cause?
Okay, that's a good question. In gynecology, we term it abdominal uterine bleeding. It's a broad spectrum of its own, where there's an irregularity in menstrual cycle that involve the frequency of the cycle, the duration of the cycle, and the volume of the bleeding. Are you getting it?
Yes, sir.
So now, when I've said earlier, when the normal volume for every woman is between 5 to 80 mil.
To 8
That
mil.
is 5 to 80.
80
mil.
mil. Oh, okay.
Once it is less than 5 mil, it has become abnormal. Yes, there are many times we give it there. I put my number, but those terms are now old terms. Now, when it is more than 80 mil, it's already heavy menses. Also, there are old terms like menorrhagia. We to give it there, but those terms are now out and dated.
Okay, all right. Thank you very much.
I'm not done.
Okay.
Now, the duration, I've said it earlier, should be between 2 to 7 mil, less than 80 days. If it is more than 8 days, there is a name, we call it prolonged menses.
Yes.
Do we get it now?
Yes. Okay, so another question, sir.
Okay.
Someone asked, does fibroid have a connection with menstrual cycle?
Yes, it does.
How?
It does. That will now bring me to other questions you asked earlier. Okay. Yes, the International Federation of Gynecology and Obstetrics, we arrange a time for abnormal uterine bleeding. That should be year 2018, called a PAM Cohen. So it divided into structural and non structural. Under structural, that is where we have fibroid. Yes, there are other ones like polyps,
ovarian.
That one, ovarian is other non-structural.
Okay.
We have polyps, we have adenomyosis, malignancy like endometrial cancer, ovarian cancer, leiomyoma. That leiomyoma is the term we give to a fibroid. So fibroid do cause heavy menses for women.
Wow.
Yes.
Okay. All right. Another question, sir.
Okay. Though not all of them.
Not all of them.
Yes.
Okay. And hey, there is speculation that goes. No, it's speculation, but people do ask. It has been an argument. If someone can get pregnant during menstruation, like when you just like get pregnant. No, or let me rephrase this thing. You can be pregnant and you're still menstruating. Is it possible?
It's possible.
How?
But actually, it is not menses.
What is it called then?
There's a name we gave it. At that time, it occurred in implantation. That is the embryo is attaching to the endometrium.
Okay.
So there's a little disruption between the endometrium and the embryo. So it now tickles some blood. Some will say, but I saw my menses last month. Actually, it is not menses. It's just from the...
like it has the same features with... people who have menstrual symptoms. You understand? Like cramps, nausea, and other stuff. So, can someone pregnant still have that same feeling when the blood is coming out and still have the same date of, probably if the person makes use of makes use of a calendar, for example, people do make use of calendar, and the bleeding stops at that exact date is expected to stop. I don't understand. Is it still menses?
It is not. It won't be that exact day. She's expecting it.
Okay.
Yes.
There'll be a change.
Yes. So the cramp will be there, but the duration of the cramp will be shorter than the usual cramp. She's
having.
Yes.
Okay. All right. So another person asked, during ovulation, when is the right time to have a baby boy?
Oh. Yes, we have that. It's a school of study anyway. Yes, though it works sometimes, it doesn't work. We believe that XY chromosomes, for X chromosomes, the sperm has X Y
So
chromosome.
please explain the XY. You know there are no medical.
Okay.
So what's the XY?
Okay. It's a chromosome inside the sperm. It's also inside the ovary. For the women, it's XX. Do you understand me?
Okay, for a baby girl is XS.
XS.
Okay.
For a baby boy, is XY.
Right. Okay.
So we can donate XY. We can donate Y.
So it's you people that is donating it to us.
You have your own
Okay, I have my own.
in the egg.
Okay, in the egg. Okay.
Yes.
Yeah.
We too. We have our own in the sperm.
Oh.
Do you understand me?
Yes.
So the one in the sperm, the one we donate, is XY. So when it's coming, it can come. It can only release one. It's either it will release Y chromosome, or it will release X chromosome. But women always donate X chromosome.
Okay.
Yes.
So when is it? I think they calculate this stuff. I know I've heard someone say the first day of your ovulation you give birth to a baby girl, while this last day of your ovulation you give birth to, if you have intercourse with your husband, you give birth to a baby boy. How true is it?
No, that is not. It's a partial true.
Okay.
As I said earlier, the X chromosomes is slower in ascending the reproductive tract of a woman. Why the Y chromosome is faster. So the X chromosome is slower but lasts longer. Why the Y chromosome is faster and die early. Do you understand me? So for a woman that is planning to have baby boy, you can now calculate your ovulation day. From that your ovulation day, count 3 days backward. If your ovulation day, as I said earlier, is on the 14th of this month, now count 3 days backward. That is 13, 12, 11.
Yeah.
From that 11, if it is baby boy you are looking for, it will, you can have sex with your husband that time. The Y chromosome will go there. As I told you earlier, that it can last for about 72 hours.
Yes.
So from that 11, 12, 13, 14, the egg is already ready. So we now believe that the Y chromosome can fertilize the egg that always donates Y chromosome. So if it's a girl, you can now wait from 14, count it forward, 15, 16, 17.
Same 3 days. 3 days forward for girl.
Yeah,
3 days
forward
for boys.
Yes.
Well, does it really work? Is it 100%?
No, it's not. It's still in school of study. It works sometimes, but the failure rate is high. It's quite high.
Okay. So, to our next question, someone asks, please, at what age does menopause start?
Okay.
People do have, also, I heard that when you start seeing your period on time, let's say, some girls do start at the age of 9 or 8 or 10 to see their period, they would have their menopause on time, let's say 14. That's why our mothers will always rush us to go and marry early so that we can give birth. How true is it?
It is true, but not all the time correct.
Yeah.
Yes, but though we believe that early menarche, menarche is when the first time a woman see a menses, the first time.
Yes.
So early menarche is one of the factors that can make you to have
Menopause.
early
Wow.
menopause.
So does it mean that someone can have menopause at the age of 39?
Oh no.
Okay.
That is abnormal. When it is less than 45 or 40, we call it premature ovarian failure, or premature ovarian insufficiency. Yeah.
Okay. So someone asked, during menopause, can a woman still give birth?
It's possible
How?
with the help of in vitro
IVF.
fertilization, yes. Though you can still give birth, but it's very rare.
It's slim.
Yeah, because at that time, most of the follicles they are old. Many have gone.
Wow.
Yeah.
Okay. Another asked, what are the side effects of menopause? Does it have side effects?
Yes.
Okay.
It has, the beauty of every woman. I will make it very expressive so that I won't use any jargon this time.
Okay.
Yes, the menopause, the estrogen, that is the beauty of every woman. That is the secret of every beauty. If you notice from age of 9 years, 10 years, 13 years, you will start having growth spots, the breast start coming out, your carry angle, your pelvis started growing
Wider. Okay.
Yes, the secret is estrogen. You understand me?
Yeah.
So, as years going by, from age of 45, the estrogen is going down. You understand me? So at that period, you will start seeing women having a lot of side effects. You see them say, I'm having
Knee pain. Joint pain.
joint pain. Yes,
Osteoarthritis.
yes,
Okay.
because of the estrogen has gone down.
Has gone down. Wow. So it's because of osteoarthritis.
Yes,
Waist pain.
waist pain. Yes, back pain.
Back pain. Wow.
Yes, even some do have mood swings. You just see them wake up in the morning, getting angry unnecessarily, and they're asking themselves, why am I angry? You understand me? It is some having hot flushes.
Odd what?
We call it hot flushes.
What
At
is
night, you just see them sweating. Have it cold, yes, have it cold. And also, because it is the estrogen that give them that mucus in the vagina. Do you understand me? The mucus will go down, the vagina will start becoming atretic. At that period, they won't have again pleasure in having sex. So libido goes down.
Reduces.
Yes.
Hey, no wonder. Is it so with the men? Sorry, I'm actually going off.
No, it's not so with the men.
It's not so with the men.
Yes.
The libido is still.
A man at the age of 80 years can still impregnate a 15-year-old girl.
Ha!
Yes.
Hey! Oh, I don't. So why is it like that? Why?
I think it's only God that can answer that question.
Okay, only. Okay, so the last question, sir. Can you tell us about these irregularities in ovulation? You've mentioned it before, but please, can you go further? And menstruation amongst young women.
Irregularity. I've said earlier. When the durations, the frequency, the volume, and the variation change. Do you understand me? So, I've told you earlier, when the volume is scanty, it drop. Do you understand me? You start getting worried that this thing is not the way it is again. And when it is more than 80 mil every menses, do you understand me?
Yeah.
When the frequency change from before you have it at 28 days, now you are having it at 40 days, 80 days, it is abnormal. There are many things that can cause it, like polycystic ovarian disease.
Yes.
Can cause it, can give you scanty, and it can also give you heavy menses.
Yeah.
Yes.
Can give you heavy menses. So
we
I have.
we can start and going ahead and start telling you the pathophysiology of that.
Wow.
Yes.
So someone that has POC can, like, it's difficult to actually know when you have POC. Am I right?
It's not difficult. There are some complaints they usually come down with, especially the one that are married among them. Yes. We have a criteria for that. We call it Rotterdam criteria. When you start having the artery, the first one for people that do have polycystic ovarian disease, when you start having dysfunctional ovulation, that is when it is lower. We call it oligomenorrhea. Oligomenorrhea. Oligo means when it is less than one, when the frequency of your menses is less than 24 days.
Sorry to cut you short, sir.
No.
But how long does ovulation last? Like, period has some 5 days, 6 days. Is it same with ovulation?
Yes, the ovulation is constant. On 4th day, you see your menses, you start counting it. 14th day is constant. Either your menstrual cycle is 27 day, 28 day, 29 day. The ovulation, you start counting it from the first day you start see a bleeding till the 14th day, or the 14th day, that is your ovulation.
No, I mean, does ovulation last for days? You understand? Or is it 24 hours?
I've said it earlier.
Okay, sorry, rephrase.
Yes, ovulation. I mean, you're talking about asking of menstrual bleeding, right?
No, ovulation. How long does ovulation last? Like, how many days does ovulation last?
Ovulation means that the egg is released.
Oh, okay.
From the follicle. Assuming this is the follicle now. Inside it, we something we call oocyte. Is that 14 on the 14th day, that egg releases. So from the 14th day, till you see that 14th day is the ovulation.
Okay, is the main ovulation.
Yes, from the 15th day is luteal phase, because the egg is released. Their hormones are now taking care of that the oocyte. Do you understand me? If this is the egg, we call the follicle. Inside it, you have the oocyte. Okay. It is on the 14th day, with the help of estrogen and other hormones, is being released and ready for fertilization. Yes.
So it can dry up. That's when the free period comes in. Safe period, I mean.
It's not safe at that time.
It's not safe.
It's not safe. From that 14th day, 15th day, 16, 17, 18, 19, even some 21.
Wow.
Yes, at that time, it's not safe.
So how do one know their safe periods then?
Your safe period, from the day you start see your menses, till the 7th day, you are safe.
All right.
Also from the 19th day till you see your menses, you are safe.
You're safe.
But it is not always correct.
Yeah. Okay. Thank you very much, sir, for this wonderful time. It was really insightful and interesting. It was very, very helpful.
My pleasure.
And to my audience, I know you're very happy, though he couldn't answer all the questions, but I'm sure he answered most of the questions. We're going to be bringing this to your screen every week. It must not be health. It can be other things that concerns life. Remember, this is Cirque de la Vie, sponsored by CN Tickets and Events, and I'm your host, Mira. Play safe, stay safe, and work smart, guys. Bye.